I recently received my Wonder Smile aligners and it got me thinking about private health insurance and Medicare in Australia. So I thought I'd give you a quick rundown. What is the Medicare Levy? How does it work? What if I have private health insurance and what if I don't? So if you're interested in learning more, please keep watching. So I recently received my Wonder Smile aligners. They come in the mail and they come in this big blue box. Now I wanted to get my teeth straighter and I did look at another provider and found that Wonder Smile was a lot more cost effective. I got quoted I think somewhere around $8,000 for another provider, and Wonder Smile offers their teeth aligners for I think it was between $2,000 and $2,500, so significantly cheaper. Now this video is not paid or sponsored, it is just my 2 cents and my tie-in as to why I'm talking about the Medicare Levy and the Medicare Levy surcharge and private health insurance. So I thought I'd just give you a quick look as to what I received in here. So you get this big blue box and essentially you get a whole range of aligners. So I've got a total of 12 aligners that will take about 6 months to get my teeth straightened. So I've got to swap out my aligners every 2 weeks. So you get obviously a little guide and then bulk aligners in here. So I've had mine for a fair few weeks now and I'm actually pretty surprised on how quickly they are getting straightened. So very excited to see the end result after 6 months. Medicare gives us access to health services in Australia. It gives us access to free or subsidised services by healthcare professionals such as dentists, doctors, optometrists and other allied healthcare professionals. It also gives us access to hospitals as public patients. Medicare is an additional tax not included in your individual income tax rates. It is currently 2% of your taxable income. Now you may or may not be entitled to the Medicare Levy exemption or Medicare Levy reduction. Now this area is quite complex, so I'm not going to be running through the Medicare Levy exemption or reduction eligibility criteria. If you think you may be entitled to this, please do speak to your trusted tax agent because these will be specific to your individual tax circumstances and scenario, and most people watching this video will be paying the Medicare Levy as most taxpayers in Australia will. If your income reaches a certain threshold and you do not hold any adequate private health insurance, you may be subject to the Medicare Levy surcharge. Now this is an additional tax on top of the Medicare Levy, ranging between 1 to 1.5% of your taxable income. As a single with no private health insurance and your taxable income is less than $90,000 per year, you won't have to pay the Medicare Levy surcharge. If you are between $90,000 to $105,000, you will get charged a surcharge of 1% of your taxable income, increasing to 1.25% if your taxable income is between $105,000 to $140,000. Increasing again to 1.5% if your taxable income is over $140,000. For family and families with dependents, the threshold goes up for each dependent child. This table shows the income thresholds for the current year. Now let's run through an example of how to calculate the Medicare Levy on your taxable income. We have James. He's a self-employed builder who doesn't have any private health insurance. He is single with no dependents. His taxable income is $150,000. Using the tax rates for the year ending 30 June 2019, the tax on his taxable income totals $42,997. He's got to pay his 2% Medicare levy totaling $3,000. And because he does not hold any private health insurance, he also has to pay the 1.5% Medicare levy, for him being $2,250. Now, if we total these taxes up, for the 30 June 2019 year, he has to pay total tax of $48,247. So if James had adequate private health insurance, he wouldn't have to pay the 1.5% Medicare levy surcharge of $2,250. Now, in relation to your specific tax scenario, you are going to have to do your own research or get some help as to calculating what your Medicare levy surcharge might be in comparison to obtaining private health insurance. Now, it's important to note that just because you might go out and obtain private health insurance today does not exclude you from the Medicare levy, as timing's involved. So right now it's June, and we know that in Australia our financial year ends on 30 June. So if you went out and got private health insurance today, you would be covered for potentially up to 4 weeks, remembering that you weren't covered for the 11 months prior. Now, to be exempt from the Medicare levy surcharge, you do have to hold private health insurance for the entire year. So thinking forward, if you hold this private health insurance that you've gone out and gotten for the next 12 months until the end of the next financial year, you will be exempt from the surcharge next financial year, but there is a chance you will still have to pay the surcharge for the current tax year. So you're probably thinking, what benefits does private health insurance give me? Now, aside from the fact that you will not have to fork out extra money to pay extra tax, it is going to give you a multitude of health benefits. Now, I am not a health insurance expert, so I am going to leave the nitty-gritty details up to them, and you can go and research your own provider. But I do suggest you get healthcare cover that is specific to your health needs. You're probably wondering if I can claim my Wonder Smile aligners on my private health insurance. Now, this is going to depend on my policy. So again, I'm not a health insurance expert. If you currently have private health cover and you are thinking about getting Wonder Smile, I definitely would suggest checking if your policy covers for these type of costs. If you are thinking about getting private health insurance and you do want to get some of your aligners for yourself, do definitely check that the policy you get does cover or partly cover these costs. So I hope this video was helpful. Please remember that the tax legislation is changing all the time, so if you're going to have a go at calculating the Medicare levy or Medicare levy surcharge yourself, please ensure you are using the current tax rates. If you have any specific questions around the Medicare levy, please do contact a trusted tax agent for the right advice. If you have any questions about private health insurance, do contact a healthcare provider. Now, if you've enjoyed my video, please do give it a thumbs up and subscribe to my channel. It does help me to bring more valuable content to you. Thanks for watching, and I'll see you in the next video.